Why do we have to face calf pain that comes from nowhere every night? Why do we suddenly wake up in the middle of the night from a severe cramp while sleeping soundly? And then, why during the day, when we climb the stairs, our legs suddenly become heavy, making it difficult to lift each step? Or when we sit for a long time, when we stand up, our whole body stiffens, our legs tremble as if we have lost all strength? How many times have you asked yourself, what is the real cause? This is not just a story for anyone. Many elderly people, even middle-aged people, are facing muscle cramps and pain on a regular basis. It is not just a passing pain, but also a silent culprit that robs sleep, takes away comfort, and directly affects overall health. When young, the body has the ability to recover quickly. Just a little exercise makes the legs light again. But as age increases, aging appears. Blood vessels become less flexible, muscles lose strength, the nervous system conducts slow. And then, just a small change in diet or living habits is enough to make the legs react with painful cramps. Imagine a person over 60 years old in deep sleep suddenly has a cramp in his calf. The pain lasts for a few minutes but leaves a feeling of numbness and pain all day the next day. That person will be afraid to go to sleep, worrying, will the pain come back tonight? This mentality makes sleep more and more restless. Quality of life increasingly declines. Not only at night, during the day, cramps and muscle pain also leave many consequences. Some elderly people share that they are afraid to climb stairs because just a few steps make their calves stiff. Others complain that when they sit watching TV for a long time, their legs do not listen to them when they stand up, making them walk unsteadily. Some people are afraid to go out because they are afraid of suddenly having cramps while walking. We often blame old age, thinking that it is a natural and inevitable thing. But the truth is not so, because in addition to aging, there are many other factors involved in this process. Electrolyte imbalance, nutritional deficiencies, wrong eating habits, and especially foods that seem harmless but have the potential to cause cramps. Did you know that there are fruits that we still think are nutritious, but when used too much, they become a double-edged sword? They silently deplete the minerals necessary for the muscles, causing cramps and pain. This explains why many people, the more fruit they eat and the more juice they drink, the more likely they are to have cramps. So what are these fruits? Why do they affect the muscles of the elderly? And is there a way to still take advantage of their benefits without paying the price of painful cramps at night? In today's series, we will go slowly and carefully to understand why the elderly are prone to cramps, 3 common fruits that cause this condition, how to recognize and adjust your diet to minimize the risk, and finally, practical solutions to improve muscle health, sleep, and quality of life. Before we begin, I want to send a message to all of you. If you are watching this video, remember to like, subscribe to the channel, and especially leave a comment sharing your own experience. In what circumstances have you ever had cramps? How did you handle the pain when it came? It is these shares that will help our community learn from each other and overcome this uncomfortable condition together. And right now, let's start the journey to find the answer to the question, why do our legs ache and cramp every night, and what is the hidden cause behind the seemingly harmless fruits in our daily diet? Okay, we have asked ourselves the questions, why do we have calf pain every night? Why do our legs feel heavy when we climb stairs? And why do we feel stiff and shaky after sitting for a long time? And when we stand up, our bodies become stiff and our legs shake. Now let's delve into the causes. In the elderly, the body is like a machine that has been running for decades. The parts are no longer as smooth as before, the cells are no longer flexible, the blood vessels are no longer as elastic as when we were young. Therefore, when it comes to cramps, we cannot attribute them to a single cause. It is a combination of many factors, from natural aging to eating habits, from micronutrient deficiencies to circulatory disorders. Aging of muscles and nerves. As we age, muscle fibers lose elasticity, muscle mass decreases, and bone density weakens. This makes it difficult for the body to maintain the mineral balance necessary for muscle contraction and relaxation. Not only muscles, but also the nervous system becomes slower, and signals from the brain to the muscles are interrupted. As a result, when muscles need to relax, they suddenly contract, causing pain. Poor blood circulation. In old age, blood vessels harden, blood flows more slowly. When the amount of blood reaching the muscles is not enough, the muscles do not receive the oxygen and nutrients they need. You can imagine the muscles as an engine that is running but not enough fuel. The inevitable result is that the engine stops. For muscles, that is cramps. Electrolyte imbalance: magnesium, potassium, calcium. The three most important minerals in controlling muscle contraction and relaxation. Just a small imbalance is enough to cause disorders. Elderly people often have a poor diet, poor absorption, or use diuretics, cardiovascular drugs, all of which can deplete this mineral. When magnesium decreases, muscles lose the ability to relax. When potassium or calcium decreases, the electrical signals between nerves and muscles are disrupted, and so cramps come. Sedentary lifestyle. Many older people are sedentary because they are afraid of falling or because they feel heavy. But sitting for a long time or lying down for a long time slows down circulation, the muscles become weaker, and the blood vessels become less elastic. That is why when sitting and watching TV for a long time, it is difficult to walk when standing up, or when climbing a few stairs, the calves are already sore. Silent dehydration. Many elderly people are afraid of urinating at night, so they limit their water intake. But when the body lacks water, the electrolyte concentration changes, the muscles become tense, and they easily contract. This is a very common condition, especially in hot seasons or when the weather's dry. Unbalanced diet. This is probably the most overlooked factor. We still think that eating a lot of fruit is good. This is true, but not all fruits, nor how much you eat, is okay. Some fruits, if consumed too much, cause mineral loss, disrupting homeostasis. This is the key to cramps that few people expect. So the question is, which fruits are silently causing night cramps in the elderly? Why does eating them lead to mineral deficiency? And should we completely eliminate them or just eat them in moderation? The answer will be in the next part, when I analyze with you 3 familiar fruits that are hidden culprits causing cramps: ripe bananas, citrus fruits, and watermelon. Before going into details, I want to reiterate, if you find this information useful, don't forget to click like, subscribe to the channel, and turn on the notification bell. This not only motivates me to share more health knowledge, but also helps you not to miss important content for your daily life. And now let's go to the next part to discover 3 seemingly harmless fruits that can be the cause of your sleepless nights due to cramps. We have just talked about the common causes of muscle cramps in the elderly. Now let's take a closer look at 3 familiar fruits that pose risks if used incorrectly. I want to emphasize from the beginning, these are not harmful fruits because they still contain many valuable vitamins and nutrients. The problem lies in the dosage and how to use them. If you eat too much or eat them improperly, they can become the culprit that makes you lose sleep every night because of muscle cramps. Overripe bananas, from friend to troublemaker. We often hear the advice that eat bananas to supplement potassium, prevent cramps. This is true in many cases, because potassium is really necessary for muscle contraction and relaxation. But there is a little-known fact. When bananas are overripe, the simple sugar content, fructose, glucose, in bananas increases, while important minerals such as magnesium are no longer as abundant as when the fruit is just ripe. When blood sugar levels increase suddenly, the body reacts by secreting insulin, and this insulin reduces the concentration of magnesium in the blood. Magnesium is a substance that helps muscles relax after contraction. When magnesium is lacking, muscles are stuck in a state of tension, and the result is cramps. Not only that, overripe bananas can easily cause indigestion in the elderly, disrupt the intestines, and indirectly affect the ability to absorb nutrients. That is, even if you eat a lot of bananas, your body still does not take full advantage of the minerals, but on the contrary, it is out of balance. This explains why many elderly people who eat a lot of ripe bananas to supplement potassium have more frequent cramps. Citrus fruits, rich in vitamin C but also many problems. Oranges, tangerines, grapefruits, lemons. These fruits are famous for being rich in vitamin C, helping to strengthen the immune system, beautify the skin, and good for blood vessels. However, When eaten in excess, the amount of citric acid in them causes the opposite effect. Citric acid stimulates the body to excrete calcium and magnesium through urine. Elderly people are already prone to deficiency of these two minerals, and now they lose them even faster. When calcium in the blood decreases, nerve conduction is disrupted. When magnesium decreases, muscles cannot relax. This combination is the perfect recipe for a night cramp. Many of my patients have said that they maintain the habit of drinking orange juice every night to supplement vitamin C, but they lose sleep because of calf cramps. Only when they adjust, drink in the morning instead of the evening, reduce the amount of citrus to a moderate level, does the condition improve. Another thing to note, citrus fruits are highly acidic and can easily cause acid reflux, especially when eaten on an empty stomach. Acid reflux disrupts sleep, combined with cramps, making long nights a torture for many seniors. Watermelon, high in water but easy to lose minerals. Watermelon is a great cooling fruit, especially in the summer. It provides a lot of water, helping the body cool down. But because it is rich in water, watermelon makes us urinate more. Every time we urinate, the body not only loses water, but also loses electrolytes, potassium, magnesium, sodium. Elderly people often have the habit of eating a lot of watermelon at night because they think cool, sleep better. But the consequence is having to wake up many times during the night to go to the bathroom, at the same time losing electrolytes, and so the muscles are prone to cramps. A vicious cycle is formed. The more watermelon you eat, the more you urinate, the more minerals you lose, the more cramps. And finally, sleep is lost. In addition, watermelon has a high glycemic index. Eating a lot at night causes blood sugar to fluctuate sharply, insulin to increase, and once again, magnesium in the blood to decrease. This is the reason why many old men and women complain that eating a lot of watermelon still causes cramps every night. In short, these three fruits are not enemies of health. The problem lies in eating them properly at the right time and in the right dosage. Bananas should be eaten just ripe, not too overripe. Citrus fruits should be eaten in the morning or at noon. Avoid overeating in the evening. Watermelon should be eaten during the day, not too much before going to bed. Just by adjusting these small habits, cramps will be significantly reduced. In the next part, we will find out, if not careful, what will be the consequences of prolonged cramps? Is it simply a pain for a few minutes, or does it also contain more serious risks to the heart, joints, and quality of life of the elderly? And as always, I repeat, if you find these shares valuable, please click like, subscribe to the channel, turn on the notification bell, and leave a comment. Your experience could be the golden secret to help someone else overcome painful nights due to cramps. Now let's go to the next part to discover what consequences will prolonged cramps cause for overall health. In short, these three fruits are not enemies of health. The problem lies in eating them properly at the right time and in the right dosage. Bananas should be eaten just ripe, not too overripe. Citrus fruit should be eaten in the morning or at noon. Avoid overeating in the evening. Watermelon should be eaten during the day, not too much before going to bed. Just by adjusting these small habits, cramps will be significantly reduced. In the next part, we will find out, if not careful, what will be the consequences of prolonged cramps? Is it simply a pain for a few minutes, or does it contain more serious risks to the heart, joints, and quality of life of the elderly? And as usual, I repeat, if you find these shares valuable, please click like, subscribe to the channel, turn on the notification bell, and leave a comment. Your experience can be the golden secret to help someone else overcome painful nights due to cramps. Now let's move on to the next part to explore: what consequences will prolonged cramps cause for overall health? Many people often think that cramps are just a fleeting muscle contraction, painful for a few minutes and then stop. But if you have ever had cramps at night, you will understand that it is not that simple. The pain can be so intense that it makes you jump up, sweat. Your heart beats fast, and then there is a feeling of numbness that lasts for many hours. It is worth mentioning that if this condition repeats continuously, it will leave much more serious consequences than a short pain. Affects sleep and spirit. Crams often appear at night while the body is resting. A sudden pain can disrupt the deep sleep cycle. Elderly people who already have difficulty sleeping now have the added fear of, will I have another cramp tonight? This anxiety makes it difficult for them to fall asleep, even forming chronic insomnia. Long-term insomnia leads to fatigue, memory loss, mood swings, and even increased risk of depression. Decreased quality of life during the day. After a night of cramps the next morning, the legs are still sore. The patient will feel reluctant to move, afraid to walk, afraid to climb stairs. Many old men and women who used to like walking and exercising gradually give up the habit of moving because every time they walk, it hurts. This cycle makes the muscles weaker, circulation worse, and cramps more likely to return. Impact on the cardiovascular system. Few people know that cramps are closely related to cardiovascular health. When the body lacks magnesium and potassium, two important minerals in maintaining the heart rate, not only are the muscles in the legs affected, but the heart muscle is also at risk of abnormal contractions. Many studies have shown that elderly people who often have cramps at night are also at higher risk of arrhythmia and high blood pressure than normal. This is especially dangerous for those who are taking diuretics or cardiovascular drugs. Impact on bones and joints. Repeated cramps cause the muscles around the joints to stiffen. Over time, this abnormal contraction puts pressure on the joints, causing pain, inflammation, or accelerated degeneration. Many of my patients have complained that since I often have cramps, my knee joints are more painful and it is more difficult to walk. This is not a coincidence, but a direct result of muscle and joint imbalance. Risk of falling a cramp can happen at any time, not just during sleep. Imagine an elderly person walking. Suddenly the calf cramps. The body loses balance. The risk of falling is very high. For the elderly, falling not only causes scratches, but can also lead to hip fractures, traumatic brain injuries, dangerous complications, even life-threatening. Impact on psychology and society. People with frequent cramps often lose confidence. They are afraid to participate in community activities, afraid to travel far, even afraid to sleep in the same room with relatives for fear of disturbing them when they scream in pain in the middle of the night. This narrowing reduces the quality of mental life, leading to loneliness and mental health decline. Warning signs of underlying diseases. Sometimes cramps are not only due to diet or aging, but also a warning sign of diseases. Diabetes, peripheral vascular disease, hypothyroidism, or even kidney disease. If ignored, the patient may miss the opportunity for early detection and effective treatment. The truth to note. The most important thing I want to emphasize here is, cramps are not just a temporary pain. It is a signal that the body sends to say that something is out of balance, is lacking, or is weakening. And we need to listen and adjust promptly before the consequences become more serious. Don't think that when you're old, you have to endure it. No, aging is natural, but long-term pain is preventable. just changing a few small habits, adjusting your diet, supplementing minerals properly, exercising moderately, you can completely reduce cramps and improve your quality of life. In the final part, I will share the most practical advice, how to eat properly, what habits to maintain, and especially how to deal with cramps immediately when they occur. And as always, I invite you to click like, subscribe to the channel, turn on the notification bell, and leave a comment sharing your own experience. Who knows, your little tip may become a savior for someone else during a long, sleepless night. Now we will move on to the final part, practical advice and a call to action to improve health in old age. Ladies and gentlemen, after we have analyzed the causes together, clearly understood the 3 types of fruit that easily cause cramps in the elderly, and seen the not-so-simple consequences they bring, the most important thing right now is, what do we need to do to protect our health so that our legs are no longer tormented by sudden cramps? First of all, I would like to emphasize that cramps are not a single disease, but rather a signal, a warning bell from the body about an imbalance. It could be electrolytes, it could be blood circulation, it could be due to an unreasonable diet. Therefore, instead of just enduring or finding temporary massages, we need to change from the root. Adjust your diet. Eat a variety of foods. Don't focus too much on one type of fruit, whether it's bananas, citrus fruits, or watermelon. Instead, add more green vegetables, nuts, and especially foods rich in magnesium, calcium, and potassium naturally but in a balanced amount. Drink enough water every day, but avoid drinking too much at once. Water should be divided into small portions and drunk evenly throughout the day to avoid putting pressure on the kidneys and electrolyte imbalance. Avoid overusing soft drinks, alcohol, or coffee in the evening because these substances easily demineralize, making muscles prone to cramps. Exercise muscles and exercise properly. Elderly people are often reluctant to exercise because they are afraid of pain or fatigue. But it is the lack of exercise that makes muscles and joints increasingly stiff, more prone to cramps. Start with gentle exercises, walking slowly, stretching legs, rotating ankles before going to bed. If you have a cramp, stay calm and straighten your leg. Gently pull your toes toward your body and massage the muscle to relax it. Do not try to stand up immediately, as this may cause you to fall. Keep warm and take care of your sleep. Many elderly people suffer from cramps at night due to low temperatures and constricted blood vessels. Therefore, keep your feet warm when sleeping. You can wear thin socks or cover them with a blanket. Get into the habit of soaking your feet in warm water for about 10 to 15 minutes before going to bed. This is a simple but extremely effective method to stimulate blood circulation and reduce muscle spasms. Keep a relaxed mind. Avoid stress before going to bed. Deep sleep is a natural tonic to help muscles recover. When to see a doctor? If cramps occur too often, accompanied by swelling, numbness, or pain that lasts after the cramps, it could be a sign of vascular, neurological, or bone and joint disease. Don't be subjective. Go to the doctor for an accurate diagnosis and timely treatment. And now I want to send you a message. Taking care of your health is not only your own responsibility, but also a way for us to live happily and healthily with our family and children. A peaceful sleep, a pair of strong legs, that is the most precious gift for old age. If you find the knowledge I shared today useful, please click the like button, subscribe to the channel, and turn on the notification bell to always receive the latest videos on elderly health. In particular, I really hope you will leave a comment below, share your own story. How did you get cramps? How did you handle it? Do you have any tips to share with everyone? Those honest shares will become a source of encouragement and valuable experience for many people who are facing the same problem. Together, we have gone through the journey of finding out the cause, the culprit, and the solution. Hopefully, from now on, cramps will no longer be a haunting nightmare for you. I wish you all good health, good sleep, and steady feet on every step of life. And once again, don't forget to like, subscribe, comment, and share this video to spread knowledge to more people. Sincerely thank you, and see you in the next videos.